Good evening, everyone, and welcome to the second iteration of Virginia Votes 2025, hosted by the Prince William County Alumni Chapter of Delta Sigma Theta Sorority Incorporated. We are so excited to have you this evening. My name is Deja Redding. I serve as one of the chairs of the Social Action Committee for the chapter, and I'm joined by my co-chair who will welcome us to the event.
Good evening, and thank you all so much for joining tonight's voter education series. This is our first time doing a series of voter information on issue-specific information. Last week, we hosted on the importance of affordable housing. And this week, obviously, we're talking about reproductive rights and healthcare. And then next week, we hope that you can join us on discussion around education equity. Just want to highlight the importance of this particular topic. These are topics that not only do Delta Sigma Theta support generally, but this is an issue that we see every day in our communities, particularly as it relates to Black maternal health. We've heard the discussions around the rates of Black maternal mortality at greater rates for African American women than for our counterparts. And we think that this is a discussion important to continue to highlight and elevate, particularly as we go into this election cycle in the next couple of weeks. We want the public in our service area, which is Prince William County, City of Manassas, and Manassas Park, to be well informed not only about the issues that we're speaking about, but other issues as well. But this is a key issue that continues to be of great importance, not only for the state, but also nationally. Lastly, I'll just say, as we see kind of what's going on with some of the federal cuts, particularly as it relates to Medicaid, this is going to become an issue that continues to be elevated and be of great importance. So thank you all so much for joining. We look forward to this discussion. And please, if you have any questions, we're looking forward to hearing those as well. So thank you.
Thank you so much, Angela, for that wonderful introduction. So we are joined tonight by two wonderful speakers who have incredible backgrounds, incredible experts who bring both national and local perspectives to this work. So I'll just spend a few moments bragging on them and sharing a few details about them. First, we are joined by Dr. Jaclyn Nunziato. She is a board-certified OB-GYN and a maternal health advocate, both locally and nationally. She is the co-founder of Huddle Up Moms and started that nonprofit to bridge the needed gap between the healthcare systems and the community as it relates to maternal health. Her passions include creating opportunities for quality improvement as it relates to equitable care, improvements within the fourth trimester, incorporating an education on trauma-informed care, and perinatal mental health. Jaclyn is on several local, state, and national committees advocating for ways to decrease maternal mortality and morbidity in this country. She feels truly blessed at the opportunity to blend her passion for taking care of women of all ages with her desire to work on community outreach projects. She's a dedicated teacher and educator both at the Virginia Tech Medical School and within the community. We're also joined by Dr. Ifeoma Udoh. Dr. Udoh is the Executive Vice President of Policy, Advocacy, and Science at the Black Women's Health Imperative, where she leads BWHI's efforts to develop policy strategy, advance advocacy initiatives, and perform research in service of health equity for Black women in America. Dr. Udoh is a highly accomplished health science leader with nearly 20 years of experience in implementing science-driven and community-based solutions to advance health equity. And prior to joining BWHI, she was a senior research scientist and managing director at ETR, a nonprofit organization committed to improving health outcomes and advancing health equity for youth, families, and communities, where she was pivotal in shaping the organization's impact in health education and the well-being of individuals and communities. Welcome to you both. We are so excited to have you. So welcome everyone in, and let's dive right in. So getting started, ladies, and I did have permission to call these ladies by their first names, so Jaclyn and Ife. Reproductive justice, it's often misunderstood or really reduced to one issue. How would each of you define it, and why does that broader definition matter for voters in 2025?
Shall I go first,
Sure.
Jaclyn?
Again,
Yeah,
I'll add the medical side to it
yeah,
after.
I'll dive in. First of all, I just want to thank the source for inviting me to join you all today. It's such a pleasure. It's always a pleasure when I'm in the company of my source. My child just walked in the middle of this conversation, so that's actually perfect timing for me and perfect reflection just to think about the importance of this question in terms of what is reproductive justice. In the current context that we live in, those two words together in a sentence have actually been perceived as being this thing that is a divisive way of being in the world. Reproductive justice, anything justice oriented currently right now is considered very divisive. When we're talking about our reproductive justice, when we're talking about the bodies of women, those who identify as women, LGBTQ persons, femmes, transgender folks, that also becomes that much more divisive. So when I think about the framework of how this question needs to be answered, I think that's really important. At BWHI, we believe that the definition of reproductive justice is centered in a human rights. It's not even a belief of BWHI. It is the reproductive justice movement as it was founded by our leaders at BWHI, Billy Avery, who was our founder, who is still on our board, Loretta Ross, the Kambachi Rivers Collective, Patricia Collins Hill. These warriors in the Black feminist movement considered reproductive justice a human right to control our bodies, to control our sexuality, to control where we work, how we have sex, and how we choose or not choose to have children. At its core, the definition of reproductive justice is the right to have a child, to not have a child, and to raise that child if you choose to have one or share a life with a child, to raise and nurture that child in a way that they are safe and that they are held in spaces of love and care. That often gets conflated with the thinking about health, rights, and reproductive justice. At its core, reproductive justice is that it's a human rights issue. We get to choose what to do with our bodies, period. And when we get to choose what to do with our bodies, we get to live our lives in a way that when we make that choice, that the results of that choice should also keep us whole and healthy and should also keep our children and our families whole and healthy. Reproductive health is about the direct service, and I know Dr. Nunziato, Jaclyn, is going to get into that concept. It's about being able to access health so that your ability to keep your reproductive pieces of your body whole and healthy are a part of the mainstay of your health. But the justice movement is about our ability to have choice over our bodies, and the ability that with that choice that we should be free, that we should have babies that are free, that we should have families that are held in love and care and support. So I think it's really important to make that distinction when we talk about what reproductive justice is in this sort of larger context, particularly as it gets conflated in conversations around maternal health, abortion care, et cetera, et cetera. So I just wanted to make sure that I said those points very specifically.
Thank you. I think that framing is especially important right now as folks are kind of pondering exactly what does reproductive justice mean. I'd love to hear from you, Jaclyn, about the medical perspective.
Yeah, so I wrote down a number of salient points, and I think you hit just about all of them because I think I was going to pay homage to the where the phrase was founded in the first place. And I think what it really speaks to, and we talk about it in the medical community too, this is a human rights issue for us. And it's also something that's rooted in evidence-based care and a shared clinical decision that has empowerment and bodily autonomy at the heart of it. I think what I've seen over the last several years, and specifically over the last year or 2 years, is when we create this polarizing conversation around reproductive justice, we weaponize the meaning of it instead of optimizing the functionality as it pertains to humanity. And I think what we have done, as a society, is create this and make it into a partisan issue when when it's not. This is a basic human right. It's the right to, and it's not siloed. It's not in a vacuum. It's not about one choice. It's about all the choices that we make. And I think it's important to keep that in the context of making the best decision for you and creating infrastructure. I mean, we were just talking about before the call, there are so many things that go into allowing families to thrive and to survive and to be supportive, and reproductive justice is at the heart of that. It's not just about abortion. It's not just about a choice. It's about access to the opportunities to make decisions for yourself that give you the opportunity to thrive, to survive, to give back into your community, into your economy. It's that decision to have a baby, make a baby, when not to make a baby, but also to give back to society and to contribute. It's not in a vacuum. This isn't, I hate hearing that this is a women's rights issue when it's a basic human right issue. This isn't something that just affects the poorest of the poor or one community. It affects all of our communities. There isn't a single person that I talk to that has not been touched by a part of this framework that we talk about. And so it's incumbent upon all of us, I think, to talk about it in its broader context and to really be clear that this is not about one issue, one choice. I mean, I think if we're going to put policies and procedures in place, we want to make sure that we're removing all of the barriers that truly harm children and families. And when we look at reproductive justice, that really is at the heart of it. Because that implores things like healthcare costs, what's really driving access to care, what are the policies and procedures that are hindering our sexual health education, informed consent, bodily autonomy, the right to be educated about yourself and to make decisions. It really is so much more encompassing than I think what we have siloed it to be.
Absolutely. Absolutely. I think that that nuanced conversation is actually a great piece. I'm curious, as many families are navigating the intersection of healthcare and frankly economics, how do these structural issues connect to reproductive justice? And, maybe Ife, what policies can we imagine that could kind of help close the gaps there?
Yeah, I really appreciate that question. You know, um, we have obviously over the last 2 years been devastated nationally by the loss of Roe versus Wade. Um, it's been clear there are a number of stories about how the decision to reverse that almost 40-year policy really shifted a landscape in thinking about healthcare access for women. Um, abortion care is healthcare access. Um, we also know and fully understand that along that continuum, when we think about reproductive health, reproductive justice, that there are many other policies in place that are impacting overall health and reproductive health for women. Um, One thing in particular that is really striking to me, um, that we've been doing a lot of work on BWHI to try to get people to understand how detrimental the Big Beautiful Bill is, right? The Big Beautiful Bill, we know it passed, it is now an official law in Congress. Medicaid, Medicare, all of these different things, ACA, there's so much confusion about what these things are or what they aren't. But Medicaid is the safety net healthcare law of the land. The shifting of that bill is incredibly detrimental when we talk about women's rights and women's health. 65% of all births, I'm gonna say the number again, 65% of all births in the United States are covered under Medicaid.
Mm.
If you take that number and just look at it in terms of the framework of thinking about Black and brown women, it almost doubles that in terms of who's accessing health care under the safety net provision that has been a law of the land in the United States for decades. 65% of all births in the United States are covered under Medicare. There are people on this call that have had babies, and your birth was covered under Medicare. So when a policy shift like that happens, it is detrimental in ways that have reverberations across the thinking around healthcare for women. We also think about policies with regards to maternal health. And some of the ones that I feel like we should all be continuing to keep our eye on the prize of are things that are looking at maternal health policies and employment policies and practices around maternal health, right? So federally, we know the Omnibus Act is the 13 individual bills that call for critical investments in the social determinants of health that impact maternal health issues and extend everything from postpartum care periods for up to 12 months to breastfeeding periods to WIC eligibility. There are only 6 or 7 states that have accepted and pushed forward the thinking around omnibus acts in their states. We need to see more work and policy advocacy done at a state level to ensure that those kind of policies are in place to protect maternal health practices as well. So there are a number of ways that we can think about policy practices, not just at a federal level, but what's going on in your local jurisdictions as well that can protect women's health priorities.
Absolutely. Absolutely. I dropped more on the Momnibus Act in the chat if folks wanted to take a moment to read more on what Ife shared about. A big piece of what you were describing was about maternal health. And when we talk about maternal health from the Virginia vantage point, that's statewide, uh, Jaclyn, could you share more about like the most pressing challenges families are facing today and where you're maybe seeing progress and or innovation that's maybe giving you hope right now?
Yeah, I think to kind of piggyback, I think it's also important because Roe v. Wade was so instrumental in taking the forward progress that was already so behind. So I just want to level set because already in the healthcare space, a system that was truly rooted in sexism, ageism, a patriarchal infrastructure, right? That our entire field as OB-GYNs really rooted in systemic racism. And you layer that with infrastructure that truly has never supported women in the ways that they've needed to be. And you add on, them going into the workforce without paid maternity leave. You add on us already being the worst industrialized nation across the globe when it comes to maternal health. When you layer these things in a system that already was not functioning optimally, it was already not supporting women. And then you roll back things like Medicaid and Medicare, anywhere between 3 and 4 million births a year. That's the number that I was going to use too. And 64 to 65% of those births are on Medicaid. I implore everybody to understand that this isn't just about the people that are delivering. It's about everyone, right? This is about the people that are working in your community, that are, in, these jobs that they're working, 2 jobs at a time to really sustain and maintain their livelihood. These are the people in your community that are lifting up the community already. And when we take that supportive service away, my fear is that the numbers that were already, shameful as an OB-GYN are going to be significantly worse. There will not be a single person. It doesn't matter, if you are financially stable, that will not be impacted by things moving forward in 2026. We see Black women at a significant increase already, 4 times more likely to die of preventable illnesses related to pregnancy and postpartum. this is dating me, but one of the reasons I moved here in Virginia was because we were one of the first states to expand Medicaid, right? Because in the healthcare space, a lot of people don't realize, but we're the only specialty that global bills, right? We get one reimbursement rate that isn't set, that's set by people, not providers, right? And so when we global bill and we say that you can only take care of a mother for, her pregnancies and then 6 weeks after, we call it decapitating our ability to access care already. And now you're taking these supportive services away. My fear is that it's going to deeply, deeply impact the community and touch everybody's life. I think that a number of us are trying to be very creative and innovative with how we deliver care. Whether that's, here in Virginia, we've expanded care to incorporating doulas into practice.
Mm.
I have loved seeing the incorporation of not only doulas, but birth educators, birth workers, community health workers. As an OB-GYN and a mother and somebody who kind of lives and breathes in the community that they serve, I know that everybody that I see is impacted by more than just their health diagnosis. It's all of the other things that they bring into, right? It is being unhoused. It is, not having access to transportation. It is not, it's not just the ability for us to medically diagnose something. If we're not fully taking care of women and children in our community, there is no health care. I truly do feel that way. But I think as you have to lean into crisis. And what I'm hoping is that this will force more collaborative efforts between both community and healthcare systems and nonprofits, between policy makers and policy holders and influencers. Sometimes I think where we miss the boat a little bit is not having more entrepreneurs, more business people at the table, really pushing initiatives that aren't just women's focused, they're community focused. They're about all of us, right? Because these economic impacts are going to be huge when we pull back, Medicaid and Medicare. It's going to influence everyone. And I don't think really, people make it about a reproductive justice issue. And it's just so much more than that. I also think when you look at maternal health, there's an awareness piece. There's a disconnect between society thinking that, pregnancy is always surrounded by this beautiful experience, right? And then afterwards, we put mothers and families in communities that lack necessary infrastructure, right? I think about that all the time. We created a diaper bank here in Roanoke, one of the first in Southwest Virginia. And diapers are not covered by Medicaid. They're not covered by
Mhm.
SNAP benefits, and they are heavily taxed. And we know that every single month, mothers, fathers, people that are supporting babies in this community lose up to 3 to 5 days of work just because of diapering needs. And we're talking about women that are trying to make the decision between taking two buses or paying for gas or diapering their kiddo, feeding them formula. I mean, this is a basic needs conversation.
Absolutely. Absolutely.
Can I add to that a little bit
Yes,
because
Yes,
you
please.
got
please.
my mind buzzing,
Yeah,
Jaclyn. You got my mind buzzing, Jaclyn,
of course.
because the you're raising some salient points that I think are important for the purposes of this call in terms of thinking about again that broadness of what we believe is reproductive justice. You raised some points specifically about what policies cover what. That one is that point that you raised about diaper coverage is like one of those things that's like so sharp, right? It's like you think about 65% of all births in the United States are covered by Medicaid, but then you send the babies home with the mamas and then they can't afford the diapers. It's so sharp, right? When I think about the breadth of reproductive justice on the other end of that, and this is I want to get us back into the maternal health conversation because I think it's super important when we talk about mamas and women, particularly in the context of this call. But there's another interesting stat there that is really troubling in terms of policy, which is on the menstrual equity side. When you think about young people and you think about young women, and you think about young women who, Black women, Black girls on average in junior high and high school miss 2 to 3 days a month
Yeah,
of school because they don't have access to menstrual care products. That is also a reproductive justice issue. That is
100%.
also one that leans itself into the thinking of economic justice and policy and education justice and policy. It becomes super um, that's the baby coming in. It becomes super intersectional when you think about these policies and how they connect on all these lenses. And then again, as Dr. Nunziato said, Virginia's made some really great strides. I mean, Virginia, I have to look at my notes really quickly, but Virginia actually has a momnibus law on the
It
books,
does. Yeah, that's what
and,
I was
and,
gonna say.
and which is fantastic. And so continuously to push on other policies locally where there are other policies like menstrual equity laws that are on the land. There are states that are now doing that work where states are requiring middle schools and high schools to have menstrual products in their school systems. That's another policy inflection that I think is another one that sort of lends itself to thinking about reproductive justice for Black women. So I just you were making my mind sort of buzz there.
Yeah,
Really appreciated that comment.
yeah, of course.
Thank you. I appreciate this dialogue. I think this is a just it's so important, and I think about some of the programming that we do as a chapter and how much we have to focus on these things because although these things are on the books, so in the state of Virginia, there is that law that requires the schools to provide menstrual products for middle and high school students. However, before the year is up, they're all out before, halfway through, they're all out. So, there's still such a long way to go. I think I'd love for us to kind of just level set a little bit because I've heard the word access a few times, and I'd love for either or both of you to share a little bit about what access really means and how it looks different depending on kind of really who you are, where you live. Are you a woman of color? Are you in a rural community? Are you from a low income family? What does that mean and how do we contextualize that?
Yeah, I welcome. I will say a couple of sort of top of mind stats, but I welcome Dr. Nunziato's perspective on this because I think the medical and the health clinic perspective is super important when we talk about what access really looks like on the ground. Um, 2.2 million women in the United States of childbearing age live in counties in the United States where there is no birth center, maternity ward, or OB provider.
Mm.
Like if you look at a map, like there are 2.2 million people in the United States that don't have access to care to have their children. Um, I think that's a really important definition of access. That there are women in the United States that if they choose to have babies or not have babies, that they don't even have access to a care provider to have those children. Um, I think about access with regards to everything along the continuum of what it takes to navigate your way through systems of care. So, insurance access, um, the important work around insurance access that also links around drug policy. We've been very much involved at BWHI in this very obscure drug policy that's going to really hit home for folks when all these Medicaid laws kick in, which is called 340B drug pricing, which is supposed to provide discounted drug medication for low income communities at a discount that hospital systems are basically like stifling the money and taking the money away from. It's a federal policy. It's one of these safety net policies that exist. It's actually a good policy, and yet, particularly in Virginia, there was a huge case about this. Um, that there were hospital systems, big hospital systems, that were shutting down their wards and their hospitals in local communities. And then the bigger hospitals were taking this 340B money and funding their administrators. It's been written up in papers. We've been paying attention to it for years. So drug pricing is also about access to care. in the same way that OBs and having clinical providers or hospital systems. There are maternity deserts that exist in the United States all through the South where women on average have to drive more than 250 miles to get to a clinic to have their children. When we think about access to care, we think about those sort of systemic issues that are occurring throughout the United States, but are particularly impacting women, Black women in the southern part of the United States, which has some of the highest maternal mortality deaths that we know of. So I think those are really important to think about in terms of where we lend advocacy support.
I
Thank you.
think too, one of the statistics I quote all the time too, since moving here to Virginia, since 2012, 25% of the hospital maternity wards have closed in Virginia, and the majority of those are in Southwest Virginia. And I am practicing currently in a safety net area. I want everybody just to like picture the scenario that I just had, a week or two ago, where a patient of mine had moved to Florida, and after going through IVF, again, this is a reproductive justice issue, right? Pulling access to telling someone, because of how much money they make, they cannot have a baby, right? So this has to do with fertility options as well. They go through this entire infertility experience, which is heartbreaking, even in the best outcomes, and wound up with a baby that had, unfortunately, a fetal anomaly that was not compatible with life. And the couple had to drive hours and hours to get up to North Carolina in some of the worst moments of their life, back and forth trying to find a provider that would provide them with the care that they needed. And you replace that, right, with someone, for example, that is transgender, that is a same-sex couple, that is Black, does not speak English, that doesn't have financial means, that doesn't have the education or literacy, that true understanding of what the complexity is. And you can see very easily where we have mortality and morbidity around pregnancy. I mean, this problem will continue to grow. And so when we think about access, I always think like, yes, there's the obvious distance. There's these maps that you overlay, for example, like mental health providers that are comfortable with the number one complication of pregnancy. And then you overlay that with maternity deserts, right? But it's also about the people in close proximity. It's about people that live in a city where one zip code over does not have true access to medical providers. It's also when you talk about, a lot of people don't realize, even for patients that have Medicaid, access to care looks like the barriers that exist with the current infrastructure. Medicaid transportation will take you from point A to point B, which means if I tell you you have to go to the hospital, or I tell you you need medication that could be life-saving, you do not have the ability to go to the pharmacy to pick up the medication that you need. And so there's actually a ton of limitations already on the current infrastructure that limits people's ability to access the critical care that they need, evidence-based care. And that is part of reproductive justice. It's not only putting and dumping money and infrastructure into the community to increase access distance-wise, right? It's changing the healthcare system in general to value women enough to not close maternity wards, right? Just like many things in this country, when people or society deems them as not valued, undervalued, not medically necessary, we start seeing shifts in reimbursement rates, shifts in valuing. And for a lot of hospitals, it doesn't pay to keep maternity wards open and running. And I think it really speaks to an overall, sentiment that maternal health and childhood health is not a value in the healthcare space. And I really think it starts with understanding that this is going to require a huge cultural shift, right? A huge economic policy shift. It's going to really require all of us to be collaborative in understanding the scope of the problem is ubiquitous,
Absolutely. I'd love to share some of the comments in the chat. I see one from Tierra. She says, "I literally never felt more terrified of a hospital until I became pregnant." And we actually also have a question in the chat.
So sad to hear. That
I
makes
hate
me
that.
so sad. It makes me so sad to hear. I was just I was just recently looking at pictures. This is what happens when you have children. I know everybody who's a mom on here does this. We go back and look at the old pictures. Like my daughter's 9, but I'm like at night when she goes to bed after I'm finished yelling and
Me
screaming, and I'm like,
too.
yeah, I go back and look at the old videos, and I'm like, oh, she was so cute. That I was a bad mom today. So I go back and look at the old pictures, and we beat ourselves up and we do the thing. But I went back and was looking at old pictures of myself when I was pregnant with her a couple nights ago because I had to actually send something to someone for something. And I was so joyful when I was pregnant. I it was like I was in the best love that I could be when I was pregnant. And then I went to the hospital. And then I had the experience that so many of us talk about that we have. And I was there for a week after her pregnancy because it was all and you know all of the things. And I was healthy as a horse. I had ran a marathon when I was 24 weeks pregnant with my child. So
Oh my
Wow.
there was nothing
goodness.
wrong until I got to the hospital. And so it just makes me so sad to hear that we are still have been and are continuing to have those experiences. So I'm sorry that you feel that way, Tiara.
I'm so sorry. I hate it breaks my heart. I think one of the reasons I started doing this work in the nonprofit space and in the advocacy space because you go into medicine because you truly love
Yeah.
helping people. And what you realize is that it's not really set up, it's set up to treat and not to heal. And there are so many infrastructure problems that sometimes, there is, the person that this is preventable and that there's just not the support and infrastructure that they need. I mean, that's what keeps me up at night. It keeps me like, fighting the good fight and trying to do the good work in the community. And it also keeps me, that's why telling stories and I think having these conversations, it is all our social responsibility to, I always talk with my students, I'm sure you do too, like forget the people at the far extremes. The truth is the majority of us are in the middle and we need to bring everybody to the table to make this a true reproductive justice conversation where we are all impacted, where we're all, fighting together, where we're all thinking really creatively and understanding the scope of the problem.
Absolutely. Wow. Can I just say, so far, this has been a powerful discussion, and I cannot say thank you enough to you both for what we've shared so far. Um, it's definitely resonating, and I've been seeing some of the reactions in the chat and coming by across the screen, and this is very powerful. I'd like to share a question from Lorraine. She asks, for access, how can we help introduce more telemedicine options for reproductive support? As a newborn mom, I learned about the Maven app, which shared a lot of resources virtually for family planning and pregnancy support. Either of you, feel free to.
I'm deferring to our doc. I'm
Yeah,
deferring
Okay.
to our
so this is, this goes back to where we need policies and procedures in place. One of the things that limits our ability to do something like telehealth is that very soon, by the end of the year, I will no longer be able to bill at the same reimbursement rate that I
yes.
can when I see you face to face.
Yeah.
Already, those systems were only put into place because of COVID. We've been
Right.
fighting to increase access, and we are no longer going to be able to do that over the next couple of months. And I think it's going to be devastating for a lot of people that cannot access that care.
Yeah.
I think it also means for us being very creative and innovative. I was part of the Virginia movement to create a mental health access line here. For those of you who may or may not know, Virginia, as of last year, opened their mental health access program, where any provider or any practitioner or community member can call an access line and speak to a reproductive psychiatrist. And they can also call to get care navigation and help. We've called, we've hooked up people with doulas, with midwives, with birth educators, with the housing authority, with diaper banks, because we're really trying to meet those needs. I also think it goes back to finding your community. I started, it wasn't my intention to start a nonprofit at the same time I was having babies myself. And it's never lost on me that, I had, this is not about my birth, but, a stat C-section early, a baby in the NICU, preeclampsia. And I found it incredibly challenging to navigate my own healthcare system and to navigate through support. And I have the education, the financial means. And then it just honestly breaks my heart thinking about those that don't have those opportunities. And so there's so many different ways, finding your mom community, finding networks, using apps, being really creative with how to increase. You touched on it a little bit, but I really do also think that starts with policy and procedures that make sexual health education an imperative part of elementary, high school education that starts with women taking back power and owning their bodily autonomy and really educating themselves about what they can do as well to optimize their care over the longevity of their life. I don't think that we put enough emphasis on how crucial those important, when it comes to access to care. You can't access what you don't know. And it is our responsibility to make sure that every single person, right, of reproductive age is aware of what that means and what that means for their body and, feels empowered in making important decisions for themselves and accessing reproductive health choices when they need to.
Absolutely. You mentioned a lot about community. And I know you just briefly mentioned about Huddle Up Moms, but I'd love to know a little bit about your experience and what role that community support has played in improving health outcomes and helping women advocate for themselves.
And I'm sure you can also speak to that. So I don't want to.
I love the question. So again, I'm going to defer because I think I love that question for you.
I,
So.
I think one of the things about starting a nonprofit, I don't know if anybody is a provider out there. It is a lot of work. Anybody on the call knows that. What I didn't realize is that it not only made me, a better community member, but creating a nonprofit in this area made me a better person. It made me a better mother. It made me a way better doctor. I really cannot picture practicing where I'm not directly working with the community that I serve. Because for me as a provider, so many people come in asking questions that are far beyond the medical diagnosis, right? They're asking for support, they're asking for therapy, they're asking for community. They're asking about resources to things like diapers and blood pressure cuffs and formula and education about breastfeeding classes and how to optimize their pregnancy. And those things, are beyond the healthcare space. I would love if they could be, but it's just not all encompassing in the way that we need it to and the way we want it to. And so it's just crucial to work with community partners. I wish if I had the panacea, I think for me, for maternal health and combating maternal mortality lies in the nonprofit world, lies in community, because the healthcare system and the infrastructure is just not set up for that. And we need to really take ownership and really, empower the community to like adopt the mothers and the women and the individuals that are pregnant in our community, because in other countries that are far less financially stable and economically stable, the things that separate us are they have a lot more infrastructure and a lot more support focused on taking care of that dyadic pair and really treating that as a crucial part of society. And I don't think that we do that enough here.
Yeah.
One example that we saw during COVID, a lot of healthcare systems, and we didn't really talk about that, a lot of healthcare system, what where we saw the largest hit in the healthcare space with even people coming to appointments was in the OB-GYN space. Why? Because when you take away public transportation, when you tell women they can't bring their children to appointments, when you close schools, whose responsibility is that going to be? Women, some of our clinics had, across the country, had less than 10% show rates for pregnant individuals. One of the programs that we created was a blood pressure program for that reason, because I was kind of terrified as a provider. I know that 1 in 12 pregnancies will be complicated by hypertension. And if these moms, especially populations that are at risk, Black women, those women that are socioeconomically marginalized, people in rural communities, substance use disorder, there's so many already, right, that are going to be influenced by something like COVID or access, shutdown. I was just alarmed and really terrified knowing that these women were still in the community and not getting care. And so we created a blood pressure cuff program here in Southwest Virginia and have given over 600 cuffs to date, to women across. That comes with care coordination. And it also comes with like empowerment and how to talk to your provider and the signs to look out for. And so I think it's going to just take a ton of innovation, a ton of innovation.
Yeah,
Great.
I want to
Yeah.
add to that really just because I think that is such an important question, particularly in this moment in time that we're in. And the one thing that we know as Black girls and Black women, I'm gonna say Black girls because mine just walked in, but Black women and girls, the one thing that we know is community. We're the 92. We're the 92, right? We're the 92 that knew a certain way to go when it was time to go that certain way in 2024. We know it, we know community. We know community from a historical perspective, from Black midwives that birthed the babies during times when there weren't places to go to have babies, to having communities that show us the way and support us around being moms and sisters to one another, the aunties in our communities that backstop us, that help us raise our children. The one thing that we know is to lean into community. And so I think for these particular times, and when we're talking specifically around reproductive justice and policy and moving forward with an agenda, community matters in terms of how we stay present and vocal. We know what the issues are. And so how do we come together as and continue to stay in that space of the 92 when we need to come to places where we talk about what these policies are that we want to see moved forward. You know what the issues are. Dr. Jaclyn. Jaclyn has expounded on what's going on locally in terms of needs for greater maternal support in the local area. So how do we do programming work in community with each other, right? And about what that looks like. So the one thing that we know automatically and that is in our DNA is about leaning into community. So I just really appreciate the comments and the question.
Absolutely. And I mean, I feel like that's what we're doing here, is creating
Absolutely.
community. Yes. So I couldn't agree with you both more about that piece. I have a question in the chat from Marissa. Marissa says, as someone who is interested in women's health as a future PA in this role, how can I play a role in education in reproductive health and preventative care? Additionally, how do you navigate care when state laws limit certain services?
Oh,
I think that one's for you, Dr.
that
Nunziato.
is, yeah, I would say
Uh,
I would take that.
creatively, I think, you know, it's such a great question. I think, I grew up in New York. We were talking about that before we got on the call. And I also grew up in a time where, and, I joke about this now with my parents, this conversation about like, in your community, don't talk about politics, don't talk about religion, don't talk about race. And I would encourage everyone, it is the holiday season. Like, we need to talk about these things. If you can't talk about them with people that you have shared values, who can you talk about it with? I mean, having this conversation with my neighbor and my family and my community and talking about it everywhere we can to raise awareness. I mean, I can't tell you how many people I talk about, even just like, oh, yeah, mental health is the number one complication of pregnancy. What? Really? Or, diapers aren't covered by Medicaid, or, Medicaid only covers transportation from point A to point B, or, the fact that there's no bridging program in Medicaid, right? It's not incentivized to come out of it. Most people are working two jobs, are working, to keep their lights on. And, nonprofits are, often imploring the help of volunteers that are dedicated and often not paid. We need to dump more infrastructure into community to build up community, because that's going to be crucially important. And I think as far as being a provider, you have to get creative with the healthcare space. And, one of the things I think is our social responsibility is to make sure that we're always practicing evidence-based medicine, to really talk about reproductive justice as a complete, comprehensive ability to take care of women the way they need to be taken care of, like, period. And so, I think it's really our civic duty to tell everyone that is our shared responsibility to continue to provide access to care. I love anybody that goes into women's health. I, would, encourage everyone who isn't in women's health to talk about this as a global issue. It's not just about women's right. This is a
Yeah.
human's right.
Yeah. I'm just going to add one more thing, because one of the questions that you had there, Marissa, was additionally, how do you navigate care when state laws limit certain
Oh yeah.
services? This may be controversial, but I'm gonna say it. Get trained as an abortion provider, even if you have to cross state lines to go find somewhere to get trained. More and more, we are seeing medical schools dropping abortion care from their curriculums. More and more, we are seeing clinical providers, nurse practitioners not being able to access that part of their training as a part of their learning to support. And also, more and more, we are seeing other states, community health clinics, providers like Dr. Nunziato, other folks that are saying, come to us, we will show you how to do these things. Because you want to know how to do those things, because you will get asked how to support a patient or a client in the process. And even if you're in a state where your laws limit that, you have to be able to help them, direct them in a certain direction. And we already know that there are not enough Black doctors, PAs, nurses, nurse practitioners in the United States. And so now we're also not going to have enough Black doctors, PAs, nurses, nurse practitioners in the United States that know how to do this very specific thing that Black women need. Get the training.
100%.
Thank you.
I love that.
Yes, Marissa says thank you in the chat. We have a few more minutes left. I'd love to turn to the audience, the group here, if anyone had any questions that they'd like to ask of Jaclyn or Ife while we have them here. Feel free to raise your hand. We can call on you if there are any questions from anyone in the audience. Don't be shy, y'all.
Hi, Miss Redding. This is Deetta Taylor. Can you hear me?
Yes, hi.
Hi. This has just been such a thought-provoking conversation in such a way that I'm almost embarrassed to say I just did not have the knowledge that has been provided here tonight. And it has inspired me to know more and to learn more. Because the conversation, when we talk about reproductive justice, or when you hear that conversation, those words, it's always wrapped around this one-dimensional issue of abortion. And you've discussed so many facets of this problem or this opportunity, depending upon what lens you look at it. You've spoken about so many different perspectives that touches every single person in our community, be it a male, a female, it touches every single one. So I just would like to know, how do I have two questions. How do I become more aware? I know this is a first step, attending a session and a conversation such as this, but how do I go beyond this? And more so, how do I press upon my local and state representatives to become more educated? Because they have to know, particularly those who are drafting policy or trying to combat policy that doesn't support the needs of the community. How do they better understand so that they can go beyond this conversation of just abortion? It's not about abortion per se only. So how do we educate ourselves, and how do we press upon our state and local representatives to become more aware and to be able to articulate publicly to the communities that they serve that this issue is much, much broader? Over.
Big old question.
It is.
It's a big old question. I know we're almost at time. I was starting to type some resources into the chat. I'll continue to type them. I think the number one thing that I would, I mean, there's a lot of things that I would advise, and it's given our short period of time, there's a lot of things, but one of the things that I've also always appreciated about being a Delta myself, Pi chapter, UCLA, spring '93. Member Berkeley alumni chapter here in the Bay Area. I've been a Delta for 33 years. One of the things that I've always appreciated about our organization is our drive towards social action and our drive towards partnership in the social action space. And so you have a partner on this call, Dr. Nunziato, who is doing great work in your local community. I would also put forth that some of the partnerships that organizations like ours can continue to do are cross-sectional. Look at who's doing housing. Look at who's doing food work. Look at who's doing partner with HIV organizations, job economic programs, nursing organizations. Who's doing work in your local community that you can partner with to set out programming or to set out policy movements, to write letters, do joint letters to your local congresspeople, to your local city and governmental officials to advocate for policies that you want to see. Virginia is about to go through an election. That is.
Boy, are we.
I was just gonna say that.
Absolutely.
We've been tracking it at BWHI, and it's important, and it's an important one on
It's an important one.
And so that there's opportunities there that you can lean into. So I can't say all the things because we don't have the time, and also this was not, fully where we were supposed to land, but there are opportunities there for y'all to do that. So
Absolutely. And I'll be the first to say this isn't the last time we'll be hearing from y'all. I hope that we can welcome you again. You both have been fabulous. And like I said, the feedback just keeps rolling in about how informative this has been and how much folks have enjoyed it. We really hope to welcome you both again. There have been some more questions in the chat, and I promise you that I will share these questions out to Jaclyn and Ife and get those over to you, get those answers, those resources, all in a post-event wrap-up. But can't say this enough. What an incredible discussion. So just want to give you a thank you, Dr. Jaclyn Nunziato, a thank you, Dr. Ifeoma Udoh, for your time, your expertise, and really, truly your dedication to advancing reproductive justice and health equity. Tonight's conversation really reminded us that health policy is civic engagement. It is on the ballot, and that all of our informed voices, as I think Deanna kind of mentioned, being informed is how we can create powerful change. So please stay with us. We hope that you can join us next week on our portion on education equity. And join us for canvassing on Saturday, the 25th and November 1st at 2 p.m. at the McCourt Building, as well as phone banking to Virginia voters on Tuesdays from 7 to 9. Um, you can use the same link to log in next week. But with that, we thank you all for spending your evening with us, and let's continue to use our voices, y'all. Have a good night.
Thank you so much. I really enjoy it. I feel like we could talk for hours. I'm so
Yeah.
humbled.